Welcome back. This video in the Active Skills Health Hub aims to help you become familiar with some of the things that a healthcare provider might suggest you do for stenosis. After a while of being gone, that searing back or buttock pain catches you by surprise again. Or maybe even after a while of resting, you're frustrated by legs that still get heavy from walking. Stenosis isn't an injury that you can fix and forget. It's a condition that needs to be managed. And as that becomes more apparent, it's time to put your healthcare provider's recommendations into action. This can seem easier said than done. To get familiar with the first-line plans that healthcare providers might talk about, click the link that's on your screen now to watch What Can Be Done, the second video in our stenosis series. Often, a large part of the plan to manage this condition is in the hands of the person themselves. That's called self-management. One of the ways a person can have some control over their symptoms is to use strategies to bother their back less. The symptoms seem like they're happening randomly because you're just doing the things you've always done. But the situation might be more predictable than you think. Let's take a closer look at that now. One of the most distinguishing features of stenosis is that the symptoms are brought out by a position called extension. To better understand the biology of stenosis and positions like flexion and extension, click the link on your screen now to watch What Is It?, the first video in our stenosis series. Extension happens any time the curve in your back gets bigger. Think of it as any time your belly goes forward. The challenge comes in finding the extension in the activities that you've been doing every day of your entire life, and in finding a different way to do those same activities. Let's talk about some examples. Say you have to carry something long and awkward, like a laundry basket. It doesn't have to be particularly heavy, which is why examples like this can catch people off guard. Bending forward to pick it up is a flexion position. Flexion positions are comfortable for people with stenosis. But if you're lifting with your back, then coming back up can put you into extension. Then you have to carry your basket to the washer. People often hoist it onto their hip or rest it in front. To get out of the way, they may lean back a bit. Take a moment to imagine that now, and pay attention to how the small of your back feels tighter. Although it may not feel too bad in the moment, that little lean back, that's extension. An alternate strategy might be to use a tall hamper that you can carry without arching your back. But what about walking? Why is walking so often a problem? Take a moment to imagine one stride of walking. You're standing upright, your left leg reaches forward, your right leg stays behind. And as your right leg pushes you forward and your body starts to move with that, pay attention to that moment when the small of your back feels tighter again. That's extension. Every step you take, there's that little bit of extension. If you walk uphill, you might have just a little bit more of extension. Walking fast? Again, maybe just a little bit of a longer stride or a brisker push, and maybe just a little bit more extension. It might not seem like much, but ask anyone who's struggling with tired, heavy legs from stenosis, and they'll tell you those little bits, they add up quick. Not walking doesn't seem like a practical strategy. So, now what? Well, first off, knowing how to anticipate problems and why they're happening could help you feel more in control. Then, you can build in some strategies. Someone who knows that they can walk, say, 30 minutes before feeling symptoms may want to try planning their walks in shorter segments, say 20 minutes, and interrupt their walks with short breaks in flexion positions, like sitting, or leaning forward on a tree, or bending forward towards their toes. These breaks may give them the relief they need to be able to continue their walks, whether for social or just running errands. Extension, that tighter feeling when the curve in your back increases and your belly comes forward, shows up in all sorts of ordinary activities, things that you've done every day, all the time, without any problems before. It will take some active thinking to find and then replace the extension in your daily activities so that you can stay functional. Speak with your healthcare provider for more guidance on movements and behaviors that can help you manage the symptoms of stenosis. Another way a person might gain some control over their condition is with targeted exercise. For fitness, healthcare providers often target upright stationary cycling for people with stenosis because leaning forward over the handlebars puts them in flexion, a better position for stenosis than the extension that can happen when walking on a treadmill. People with stenosis are often recommended core exercises as well. One of the most likely ones is an exercise called pelvic tilt. That's because a pelvic tilt not only uses some core muscles, but it moves the person into the comfortable flexion position during the exercise. Simply lay on a firm surface on your back. Bend your knees and place your feet on the ground. There will be a small space between your back and the floor, just above where a belt goes. In a pelvic tilt, you're simply closing that space. Imagine pulling your belly button down to the floor while rounding the small of your back. Pelvic tilts are simple to do, but if you're not familiar with them, you might not be sure you're doing them right. For feedback and guidance on how to do a pelvic tilt and what other flexion-based exercises you might be able to do, speak with your healthcare provider. Symptomatic lumbar spinal stenosis impacts an individual's emotional state, their quality of life, and their ability to function physically. For people with stenosis, being engaged in the management of their condition and increasing their activity in a sustainable way has been called essential. Someone you know, somewhere, is suffering limitations due to lumbar spinal stenosis. Like this video, share it, and then subscribe to learn more. The information on this site is provided only as a resource for discussion with your own healthcare provider. You should consult your healthcare provider before making any healthcare decisions.